Imagine a group of invisible enemies quietly growing stronger, not from a virus or bacteria, but from the way we live every single day. These enemies don't spread from person to person, but they're responsible for more than 70% of all deaths in the world. Shocking, right? These silent enemies are called lifestyle diseases, or more formally, non-communicable diseases, NCDs. They're not contagious, but they're deadly. So let's explore what they are, why they matter so much in medicine, and how doctors, nurses, and scientists are fighting them every day, sometimes with stethoscopes and sometimes with simple lifestyle advice. What are non-communicable diseases, NCDs? NCDs are chronic diseases. That means they last a long time and don't spread from one person to another. They are mainly caused by our lifestyle choices or environmental factors, like unhealthy food, lack of exercise, smoking, drinking too much alcohol, constant stress. Unlike catching a cold from someone, you can't catch diabetes or heart disease from your friend, but you can develop them if you don't take care of your body over time. What topics do students study in NCDs? Here's what medical students learn when they study lifestyle diseases. Cardiovascular diseases, like heart attacks and high blood pressure. Type 2 diabetes, when your body can't control blood sugar. Chronic respiratory diseases like asthma or COPD from smoking. Cancers, some types like lung or colon cancer, are linked to lifestyle. Obesity, not just about weight, but how it stresses the heart, joints, and organs. Mental health disorders like depression or anxiety, often linked to modern lifestyles. They also study how these conditions can be prevented, diagnosed, and managed through a mix of medicine and behavioral change. Real-life examples, how doctors use this knowledge. Let's meet Mr. Ahmed, a 45-year-old office worker. He eats fast food every day, never exercises, smokes, and is always stressed. One day, he feels chest pain and is rushed to the hospital. The doctors discover he has blocked arteries from years of unhealthy living. A heart attack! But wait, it's not just medicine that saves him. It's education. His doctor explains how walking daily, eating fresh food, quitting smoking, and managing stress could have prevented this. This is where doctors trained in NCDs shine. They don't just treat diseases, they help patients change their lives to prevent them. How scientists use NCD research in hospitals and labs. In medical research, scientists study how genes and environment combine to cause NCDs, which diets are best for different age groups, how wearable devices can monitor blood sugar or heart rate, and how public health campaigns can encourage healthier behavior. These studies influence everything from hospital policies to school lunches. Why this knowledge is a lifesaver. Here's a secret. Most NCDs are preventable. That's right. With better choices and early care, millions of people could avoid strokes, kidney failure, and even cancer. That's why every doctor, nurse, and medical worker must understand these diseases, and every future student like you should learn how they affect our families and communities. By understanding NCDs, you're learning how to save lives without surgery or injections, just by guiding people toward better choices. So if you want to become a doctor, a health coach, a researcher, or just a smarter version of yourself, this subject is essential. Stick with this channel because we'll keep uncovering the secrets of health, one story at a time.